So I'm like, why is she losing hair if she's not taking care of herself? Like, if you haven't seen a doctor in 10 years and you're coming to me for hair loss, I'm like, what are you doing to yourself? Hey guys, this is Dr. Echefu, and we're going to be talking about 5 basic blood tests you need. Everyone just needs to let their doctor know, their regular doctor, their GP, their primary care doctor, whoever, however just your regular doctor that does your regular checkup. What are the 5 basic blood tests you need to order? Or you need to tell them, hey doc, can you order this for me? Or hey doc, can you check this for me? Number one, you're already going for your full checkup, so you need your complete blood count, okay? Your complete blood count. What did I say? Complete. I did not just say blood count. I say complete blood count. What are you checking for? You're checking for your hemoglobin, okay? You're checking if you're possible signs of anemia, okay? Especially for my ladies that have heavy bleeding, yeah, you need to check there. In addition to the complete blood count, what else are we going to be checking? I just want to pair all this together. We're checking for our ferritin levels and our iron levels here. So if your doctor checks your complete blood count, okay, and see your hemoglobin levels are low, okay, we have a range of levels for male and female. So if your doctor checks there and it's low, what is the next step? Check your iron level, check your ferritin, okay? So that you know if you're anemic, if your iron level is low, if your ferritin levels are low, and if they're low, what's going to happen? We need to replete that. We need to give you iron tablets for you to take, okay? Because that might be the reason why you're losing hair, because sometimes hair loss might be a symptom of what is going on, okay? Especially for my ladies that have abnormal bleeding, irregular bleeding. I mean, abnormal, irregular bleeding, they all fall to the same category. And heavy bleeders, yes, you need to. Especially, FYI, if you have symptoms of dizziness during your cycle or after your cycle, chest tightness, especially as a young lady, please, you need to have that checked out. Yeah, don't assume it's normal. It's not normal, okay? So we talked about what? Complete blood count, iron levels, and ferritin levels, okay? So what is the next blood test you need to ask your doctor to check for you? Your thyroid stimulating hormone, short form TSH, okay? So what is the TSH? TSH is what helps us to check our thyroid levels in our blood, okay? Your thyroid is that organ, small organ right here. And the TSH is just a simple blood test that's going to let us know how is your metabolism going. Is your TSH, if it's high or low, and your doctor can correlate that for you, okay? So we have hypothyroidism, which is your levels are low, and hyperthyroidism, which is your levels are high. So that is something you need to let your doctor know that, hey, doc, can you check this for me? And especially, what are the symptoms? I have a lecture. If you go to my old videos, you will find a lecture, okay? Symptoms of hypothyroidism and hypothyroidism and what to know, okay? So we talked about complete blood count, your ferritin level, your iron level, your thyroid stimulating hormone, and what is the final test that you need to ask your doctor to check? Your vitamin D levels. See? Vitamin D levels, okay? So why is it important? Vitamin D help with your growth cycle, okay? Your hair growth cycle is very important for your vitamin D levels to be up to the normal levels or up to the normal range. So if it's low, the doctor knows what to do, place you on vitamin D. I don't want you going over the counter to just start taking vitamin D. So if your doctor has already checked your vitamin D and it's normal, please stop taking additional vitamin D. Please. Please stop taking that, okay? We don't need emotional treatments now. So ask your doctor to check all these 5 things. You check all the 5 things already listed, your complete blood count, your ferritin levels, your iron levels, your vitamin D. And so guys, I hope I've answered most of your questions. So the 5 basic blood tests, that's all we've discussed today. So let your doctor know. So because if you come see me, I'm still going to ask you, did your doctor check all this for you? Or you can ask your doctor to check all this for you, okay? So bye-bye.